Great. Hi, everyone. This is Melissa Martin. I'm the Shy Tracing Project Coordinator at the UIC School of Public Health. I want to thank Dr. Arwady again for recording that keynote presentation for us. She covered so much material. Before we get into Q&A, I want to, first, we're going to show a short video that we think is helpful in illustrating visually how the vaccines work. So we'll cue that up and then we'll jump into Q&A.
SARS-CoV-2 is a novel coronavirus that is responsible for the COVID-19 infection. The virus works by entering healthy human cells through the crown-shaped protein spikes on its surface. A promising candidate for the treatment of COVID-19 is a messenger RNA-based vaccine from Mrna Medical. Messenger RNA, or mRNA, are strands of genetic material similar to DNA that ribosomes in the cell use to synthesize proteins. Moderna's mRNA vaccine contains the instructions to synthesize the crown-shaped protein spikes on the surface of the SARS-CoV-2 virus. The vaccine is encapsulated into a lipid layer that allows it to enter the cell. Once inside the cell, the mRNA are released and ribosomes in the cell read them to synthesize the virus's spike proteins, which are then released from the cell. The spikes themselves are not harmful, but the human immune system perceives them as though the body has been infected with COVID-19. In response, the immune system produces antibodies against the SARS-CoV-2 virus. In the presence of an actual COVID-19 infection, these antibodies prevent the virus from entering a healthy cell by attaching themselves onto the spike proteins, thereby blocking their entry into the healthy cell and thus creating immunity.
Excellent. All right, so before we jump into Q&A, I just want to let folks know, one, thank you so much for putting your questions in the chat. Please keep doing so. We are recording this part of the presentation, so you'll definitely be able to go back and listen later, because we're going to hopefully get through several questions. Right now, I want to give our panelists an opportunity to introduce themselves before we jump in. So we have Dr. Linda Forst from the UIC School of Public Health. Dr. Forst, you want to introduce yourself?
Yeah, sure. Great to be here. Great to see all of you guys. My name's Linda Forst. I'm a medical doctor at University of Illinois, and I am a faculty member also in the School of Public Health. So I teach and do research in the School of Public Health, and I see patients over at the medical center. Really great to be here.
Thank you, Dr. Forst. And we have Patrick Stonehouse from the Chicago Department of Public Health. Patrick, you want to introduce yourself?
Sure. Good morning, everybody. So again, I'm Patrick Stonehouse with the Chicago Department of Public Health. I use he, him, his, or masculine pronouns, or anything else with respect is fine. Prior to COVID, I was the Director of Public Health Operations for the HIV/STI Bureau at CDPH, focusing on HIV prevention efforts, as well as systemic and structural barriers to health outcomes for specific populations. So basically, like, what are the things that need to change across the entire system so that we can see improvements in health outcomes for folks. During COVID, I'm working with a bunch of really great people, including UIC, NORC, Sinai Urban Health Institute, Malcolm X, and the Chicago Cook Workforce Partnership to try and provide all the support that we can to you all as the contact tracing core and the resource coordination hub so that we're able to do what we need to do in order to keep folks healthy. So thank you.
Thank you. All right, so folks, we're going to do our best to get through as many of the questions as we can, and there's so many. So just know that if we don't get to a question today, we will definitely follow up. So I'm going to start with you, Dr. Forst. Can you first kind of explain, what does efficacy mean? We heard that in Dr. Arwady's keynote.
Yeah, the word efficacy is really the same as effectiveness. The word efficacy is used when you're doing a trial, you know, when you're testing a vaccine in this case. So you're giving some people the vaccine and you're giving some people a placebo or a dummy, and then you're following them out to see how many people get the virus. So efficacy just tells you the percent of people that are prevented from getting the virus.
Thank you. And what's the difference between mRNA and DNA?
Yeah, DNA is really the code for your whole biological system. It resides in the nucleus of your cells, and it stays there for your life. Messenger RNA or mRNA gets into the cell, but not into the nucleus. And the messenger RNA is really only coding for a specific protein, one protein.
And so how are they able to develop a vaccine so quickly for COVID, but not for other common illnesses like the common cold?
Yeah, you know, messenger RNA, mRNA has been worked on. So you probably know that in our lifetimes, genetic research has gotten really great and very advanced. There are a lot of new tools and stuff. And so for about the last decade, there's been a lot of work done on messenger RNA, a lot of testing in the lab and in small populations for all different kinds of things. And so they were really able to purpose all of those studies to directly deal with this virus. So it sounds like it's been developed fast, and for this virus specifically, it's developed fast, but mRNA technology has been around for about a decade, and there's been lots of underlying research.
Excellent, thank you. A couple of CDPH questions. So Patrick, when and where will people over 65 be able to get the vaccine?
So specifically when, so a lot of this stuff is available on the chicago.gov website of vaccine planning. So the where of it is going to be, so we're standing up vaccine pods or points of distribution at various points throughout the city. And those are going to be starting like next week. So we're looking at places on the south side, places on the west side, so that we're trying to make it as accessible as possible. And then we're also eventually going to be standing up some mobile vaccination opportunities that are going to travel around to different places to increase, to make it easier for folks to access. The specific when is going to be, as Dr. Arwadi stated during the keynote, it's all about like how we work up through these different phases of access. So some folks are able to get access to it now based on where they're residing, based on the specific issues that they've got and the interactions that they have and connections with medical facilities. So it's all just part of the process of rolling it all out.
Thank you. And Patrick, I think this is for you too. Will the vaccine be free at those sites?
Yep. Yeah, at our sites, it's going to be totally free. And one of the things that we mentioned yesterday is that there's not going to be a charge for the vaccine itself. There may be, if one is to go to like their primary medical provider, there may be like a copay or something related to that for the visit, but getting vaccinated is not going to be a charge.
And Patrick, we have a request if you can speak a little bit louder.
Will do.
So, Dr. Forst, so should a person take an antibody test before getting vaccinated?
No, the recommendation is that even if someone has had COVID in the past, that they should go ahead and get the vaccine. So knowing whether you've had it in the past is not a useful piece of information.
And will it ever be recommended, or do we know if it'll be recommended to just get one dose instead of two, since so many people need the vaccine?
Yeah, not currently. So currently, because the studies were using 2 doses of the vaccine, and that's the data that we have available, and that's what the approval was based on, there will be a continued need for 2 doses. But I'm quite sure that over time, there will be more testing of this, and the recommendation may change.
And Patrick, question for you. Will the contact tracers and resource navigators have the opportunity to get vaccinated soon?
Yeah, so I mean, the biggest way that you'll have an opportunity to get vaccinated is through participating in staffing these vaccination pods that we're standing up starting next week. So the Chicago Cook Workforce Partnership sent out about a month ago a survey asking if people were interested in working at these points of distribution. And if you are going to work at the point of distribution, you will have the opportunity to get vaccinated as part of your work there. It will not be required, but it will be an opportunity. And that's the quickest and cleanest way for an opportunity for folks.
Dr. Forst, can you share what are some of the common side effects of the vaccine?
Yeah, when people initially get the vaccine, the first dose, the main side effect is pain in the arm. I got the shot, and it actually wasn't painful at all, but that night when I was in bed and rolled over on my arm, it was sore. Usually after the second dose, if you're going to have a side effect, it comes after the second dose usually. And that could be fatigue, a little headache, maybe a little bit of achiness, sometimes a low-grade fever. Those are the side effects. They resolve in a day or so.
Right. And has anyone gotten the vaccine and then developed COVID?
Yes, 5% of people that got the vaccine in the clinical trials developed COVID. That's how they've been able to say that the Pfizer is 95% effective and the Mrna is about 94 something effective. And that means that about 5% have gotten COVID after the vaccine.
And so if you get COVID after getting vaccinated, will it impact if you're symptomatic or asymptomatic?
Yeah, there's a lot of evidence from those 5 or 6% of people that got it, that the severity of the disease is much less.
And let's see, I've seen videos of people with facial distortion, so Bell's palsy, after taking the vaccine, as well as multiple health workers who have taken it and then had to spend the night in the hospital after losing consciousness. Can you talk about this?
Yeah, well, let me separate those 2 items, okay? So the first is the contortion of the face is also called Bell's palsy. Bell's palsy is a very common disorder in the general population where you lose kind of your nerve impulse to side of your face and you get a droopy face. Usually that resolves all by itself. And so there were a handful of cases of people that were vaccinated that got Bell's palsy. The question is always, did they get it as a result of the vaccine, or are they just part of the general population that all of us have the potential to get Bell's palsy. So it's really not known if it's connected to the vaccine. Again, generally it resolves. And second, it's a side effect that's being followed. So there will be more known about it. But I think to date, there were 7 cases with Bell's palsy. Remind me the second one.
Yeah, after taking the vaccine, multiple health workers had to spend the night in the hospital after losing consciousness.
I don't know I don't know that story of people having to spend time in the hospital. People have passed out as a result of the vaccine. There are 2 reasons that people pass out as a result of the vaccine. One is very rarely a person could have an anaphylactic or an allergic kind of reaction. Now that's taken care of. Maybe we'll talk about that separately in a few minutes, but that's taken care of by epinephrine. That's why you wait after the shot. And the site always has epinephrine available to be able to treat anyone that would have an allergic reaction. The other reason that people pass out is it's like a neurologic anxiety reaction. And this goes with all shots, all injections. It's not really related to what's in the injection, but people sometimes pass out. It's just an anxiety neurologic reaction that causes people to lose their blood pressure and they pass out. If people have been kept in the hospital after that, it's really only to really watch them. But that's a very common side effect. I've seen it many times. I've had family members experience it. So it's not uncommon.
Thank you. So the vaccines contain mRNA as well as, which has never been used before in vaccinations. It is genetic coding. Why is that present if not to code genes?
Yeah, RNA does not code, it is not a gene. RNA is a mirror of DNA. It comes off of a gene and it only codes for a protein. So there, they showed you in that video that the mRNA that is injected, that sits in the cell but outside the nucleus, it only codes for that spike protein. It just spits out the protein into your bloodstream. It doesn't code for anything else. So it doesn't get into your DNA. It doesn't even interact with your DNA. So it really isn't relevant in genetic coding per se.
And is it safe to get the vaccine if you're on other medications like blood pressure medication?
Yes. Most medications, there's no problem with getting the vaccine at all. Medication to treat diseases, mostly there's no problem. The only medications where it could be questionable is if you're on immune medications, medications that suppress your immune system. And it's not really because there will be a problem with the vaccine. It's really because the vaccine may not be effective. If you can't mount an immune response to the vaccine, then the vaccine is not doing what it was designed to do. So somebody getting immune medication may not become immune to COVID if they get vaccinated.
I think a question for Patrick, will vaccines ever be mandatory in Chicago?
I don't think so, no. Well, at least we have zero plans for mandatory vaccination at this point.
Employers may require vaccinations, and the Equal Employment Opportunity Commission has talked about that on their website, but so far nobody is requiring it. So employers, healthcare, hospitals and such may end up requiring that in the future.
Great. And Dr. Forst, can you talk a little bit more about why people are having allergic reactions to the vaccine?
Right. So the vaccine, people, all vaccines come in sort of a carrier. And you saw in the video that mRNA is kind of embedded in this fatty lipid surrounding glob. And that's how it gets into the cell. And then that glob kind of dissolves off and the mRNA does its job. Well, what that glob is composed of is a bunch of fatty chemicals, and pretty rarely people are allergic to one of those chemicals that's in there. And so that's how the allergy comes about.
And so what's the difference between the two vaccines?
There's not a lot of difference between the two vaccines. The main difference is what is in that fatty glob. They both have mRNA that code for the protein, so those are almost exactly the same. but the carrier molecule is different in the vaccines.
And are people who get vaccinated able to get the new mutated strands of COVID?
You know, the vaccine should protect against that because the coronavirus has that spike protein on it. The vaccine is causing you to build up antibodies to the spike protein. So regardless, any coronavirus that has that spike protein on it should be attacked by your immune system if you're vaccinated, regardless of the strain of the coronavirus.
And if a vaccine only has a 60% efficacy, will that be enough to combat the virus?
Yeah, that's a really great question. I saw it in the chat and I was thinking about it before I started talking here. 60% is pretty good, obviously not as good as 95%. So you could say, let's say that if 60% of the population is vaccinated, I'm sorry, if 100% of the population is vaccinated, that only 40% of the population will get sick if they get infected. So 60% really reduces the number of people that will get infected. So 60% is not a terrible number, but obviously 95% is much better.
And how long does immunity last?
Yeah, it's not really known yet how long it will last. So far, you know, they started the trials. I want to say they started the big trials, phase 3 trials in November. So from November to present, they know that the efficacy is 95%. We have to just follow it out and see how long it takes for, you know, how long people stay uninfected, let's say. And so everybody that's been in the studies is being followed, and actually everybody that's getting infected is being asked to put their name into the CDC's database and report if you get COVID, because that's how we're going to know really how effective that the vaccine is and how long that lasts.
And can you get the first dose of one vaccine and then a second dose of the other?
You know, at the moment, that's not recommended. The reason is that that hasn't been tested at all. And so the recommendation really only can go as far as what the testing that's been approved has shown. And so far, they're not recommending that. That could change, but not now. Probably not for the next 6 months.
And do we know which vaccine is better for people who are high risk to immune conditions or allergies?
You know, neither one is demonstrably better than the other one. So far it's not known. That also might become available, and we'll all get to see that information as that rolls out.
And if you have allergies, should you bring your Epipen to your vaccine appointment?
You know, you don't need to bring your Epipen, because anywhere that you're getting vaccinated ever, for any vaccination, that place has epinephrine there. They're supposed to have epinephrine there. So you don't need your Epipen. It's available at the site. And again, that's why you're being asked to wait. People that have prior allergies are actually being asked to wait for 30 minutes instead of just the 15 minutes that everyone else waits for that reason.
And here's one I think for you know, either one of our panelists to weigh in. So when it comes to the Black community, there is hesitancy to take the vaccine because of past concerns like the Tuskegee experiment. Without adequate Black and Hispanic participation in clinical trials, community members feel that there is not enough information shared about the results of clinical trials, specifically on African Americans. Where can we find more information about the trial results on African Americans and Hispanics to understand if they will be truly effective?
Would you like to talk, Patrick, or?
Yeah, I'll take just like a first initial thing. So just it was put in the chat earlier, could we have it put in the chat again about the making it plain what Black America needs to know about COVID? So tonight at 6 o'clock, there's I think a national town hall that's being held on facebook.com/blackdoctor.org, specifically about what Black America needs to know about COVID-19 and vaccinations, where they'll be going over a whole bunch of that specific information.
And what I can say is that African Americans and Hispanics were included in the clinical trials in very large numbers. And so the data, the data is there, it's available from the studies. You'll hear about that in more detail. And, honestly, there's no physiologic difference between Blacks, whites, Hispanics. We all respond in the same way. The issue might be about people with underlying diseases, medications, and so on. There's no reason to think that there's any difference in response to the vaccine itself. But watch the video this evening. If you can't watch it tonight, it'll be recorded, I'm quite sure. And there should be lots of information floating around. If you go to blackdoctors.org, they have information on the website that you can view even now about that.
Great, thank you both. So would it be okay to take the vaccine if you cannot take the flu shot?
Yes. But I don't understand, you mean if you can't take the flu shot because you have allergies to it, or?
I'll ask if, Karen, if you can clarify, but I think that's where, You
mean if there's crossover, maybe you mean if there's crossover allergies from the flu vaccine to the COVID vaccine. Yes, you can. There shouldn't, flu vaccine is created very differently. The carrier molecule is very different than what is in the coronavirus vaccine. And so there isn't cross-reactivity, immunologic response from the flu vaccine to the coronavirus vaccine. But again, if you have had an allergic reaction to other vaccines, you would tell the provider where you're getting the shot, and you would wait there for 30 minutes and make sure, make double sure. But there is no increased risk from having an allergic reaction to the COVID vaccine.
Great, thank you. Patrick, can you share again where people can find information on, when they can get the vaccine? So like if someone's over 65 or those different tiers that Dr. Arwady referred to.
Sure. So I got another one in the chat that you can't hear me. So yeah, the best place is for what's going on in the city of Chicago is chicago.gov COVID vaccine. It has in it the vaccine planning, the rollout, the different schedules that we've got, as well as a lot of information about frequently asked questions, the locations, a lot of the materials that have been produced that folks can just take and disseminate on your own. So that's the best place at this point to find all that information.
Okay. Thank you. And will there be some kind of registry for those who have been vaccinated?
We are currently registering folks for the vaccination. And so we do have like a tracking mechanism so that we can follow up with folks, and we ask folks to like follow up with us and keep us posted of any side effects or negative experiences that they have. We have that registry so that we can, do our appropriate and responsible follow-up with folks so that it's time to go back in and get your second dose, that kind of thing. And so that we can do like a really solid assessment of how well we are seeing the spread of the vaccination opportunity across the city, across certain community areas, or across different populations. So yeah, we have that kind of a registry in place.
And will you ever have to carry proof of being vaccinated?
Not that I've heard anything about. I mean, I think similar to what Dr. Forst was speaking to earlier, like certain employers may require a person, like in instances like that, you may have to, but it's not going to be. It's not going to be a thing that's going to be coming down from the city of Chicago. I don't believe that we're going to be issuing these sort of like vaccination cards that you're going to be required to carry around. I don't see that happening.
Dr. Forst, will I need to still wear a mask after getting vaccinated? If so, why?
Yes, we will all still need to wear masks after we get vaccinated. The reason is that, again, 5% of people that get vaccinated, as far as we know, are still possibly susceptible to the virus. So you don't know if you're in the 5% or the 95%. And the other thing is that the more, over time, the whole population will get vaccinated. And when everybody is 95% protected, then the risk to everybody is going to be lower. So the more people that get vaccinated, the lower the overall risk is. And over time, there will be some point at which public health officials say we can stop wearing our masks. But I'm wearing mine until that time.
Thank you. So another mRNA question. So if there is no strand of the virus in the vaccine, how is it able to identify the virus in the immune system?
Yeah, that's such a good question. Somebody asked a similar question yesterday, and I went home and really studied and thought about how to answer that question. The mRNA is not really coding for the virus specifically. It really only is coding for that spike protein that is on the virus. The spike protein that is on the virus, it's like on the shell around the virus. It's what makes the virus sticky. It sticks to the cells in your body. It gets into your lungs. It sticks on the cells in your body, and then it allows the transfer of the virus, the viral particle, into your cells. And that's what starts to make you sick. That virus machinery kind of hijacks your cell and makes your cell reproduce it and then spill it back out into your system. When you get the messenger RNA, you're not getting the whole virus. All you're getting is the little code to that spike protein. You're only getting the code for the protein that makes the virus sticky. So that mRNA is not, all by itself, is not making you sick or really doing anything else at all. It's really hardly related to that virus. So that's one thing. The other thing that I looked up, which was asked yesterday, was how long the mRNA sticks around in your cells. And it's somewhere between minutes and hours. I couldn't get an exact number, but it doesn't last more than hours. Your body, it denatures, your body isn't utilizing it or translating it anymore after a few hours.
Great. Let's see. Do you think we will need to get vaccinated annually?
It remains to be seen. With the flu virus mutates and it looks different every season. What would have to happen with the coronavirus is that it would have to mutate in such a way as to make that spike protein different somehow. And I don't think it's really likely, but it remains to be seen. It's possible, and we may need to get it every year.
Patrick, question for you, or if you could clarify that how much of this vaccine information we expect contact tracers to share with the public?
So as part of your role as contact tracers, really, I mean, because you and I, we are not medical professionals. We should not be offering medical advice in any instance at this point. So, use this information to address any concerns or questions that you receive from folks whom you're reaching out to as part of your contact tracing efforts. And part of it is, part of the purpose of sharing all this information is with you all, and I'll talk about this a little bit later, is just like to answer your questions, answer your areas of concern and what you all want to know, so that you're able to speak with a greater level of confidence when interacting with contacts that you're talking to as part of contact tracing. And so it's really not like, we want you to be like sharing all of this information with the folks you talk to in the contact tracing process. More usually it's going to be like, please take a look at these sites. Here's some more information that you can gather from different places. It really, and obviously recommending talking to a medical provider. So this stuff is really for your information, for your confidence in having these conversations as part of contact tracing, as well as outside of contact tracing. And I'll talk a lot about that later on. But like this is for you as human beings, for your own information, sense of well-being, confidence, your ability to engage in a respectful conversation about what your concerns remain to be, and share this information with your friends, family, loved ones, coworkers, neighbors, all that.
Thank you. Let's see. I have a vaccine appointment scheduled for something else. Should I space out appointments for different vaccines?
Oh, I'm not sure how that's being handled. I have to get back to you, but I just want to point out that multiple vaccines are usually often given in the same visit. One doesn't negate the other, but I haven't read the recommendation about vaccines. I mean, my advice would be to get it as soon as it's available to you, to step up in line and get the vaccine when it's available to you, and follow up 3 weeks later for the Pfizer or 4 weeks later for the Mrna, and do it right away and don't put it off. But I'm guessing there's not a contraindication to getting two at the same time, but I actually don't know what the recommendation is now. I need to get back to you about that.
And forgive me if I asked this one already. So why do people keep saying the vaccines are the same, but you can't get one dose of each?
Well, only because it hasn't been tested that way. The way these vaccines get approved is each of the different companies, did their big clinical trial, and they didn't cross them or cross over them. So maybe in the end, they will be effective if you do cross over, but nobody's looked at it. So you don't want to take a theoretical approach to this. You want to really know, 2 vaccines of this protect you, 2 vaccines of that protect you. We don't have any data on one of this and one of that. So it's better to just follow the recommendation.
Are there any specific allergies we should be aware of that may influence a reaction to the vaccine?
Yeah, that is a really good question. I looked that up yesterday also, and I heard about one chemical agent that is in the fat globule that surrounds the mRNA of the Pfizer, which is paraethylene glycol, something like that. PAG. Oh, I got to look it up, sorry. PEG. But most people don't have an allergy to that. I'll look it up exactly and tell you exactly what that is, but it doesn't look like there's crossover between other vaccines and this vaccine.
And so bear with me. Just to clarify, so the question we had earlier about the Black community and hesitancy around the vaccine, do you know where we can find more information about the trial results and on African Americans and Hispanics? So is there data points that we can point people to?
Yeah, you know, I would go to blackdoctors.org, the CDC website, the CDPH website, of course. If you can struggle with the, the reports on the actual drug trials are available online, and they have tables in those reports, the raw data and tables in those reports, and they're broken down by race and ethnicity. So you actually can look at the raw data. Those reports are they're kind of onerous to wade through. So having somebody else digest that is easier. But you can see that, the actual data. Yes, absolutely.
And thank you for that question. And I think we can put that in our follow-up materials, links to those studies. Okay, let's see. So what kind of proof or certification will I get after getting vaccinated, and will it be useful for travel?
You know, it won't be useful next week, but I think over time, you know, by the time everyone gets vaccinated and we have more experience, there's more data available to us. I am guessing that there will be some point at which people who are vaccinated will be able to travel more freely. And so I would say that you know, you do or you should get a card or something that says you have been vaccinated, or maybe you'll get it through email from the place where you're vaccinated. So hanging on to that, I would say, is really important. You may be able to use that at some point for work or for travel or for something else. Definitely.
I heard that there are some vaccines in development that are more like the past vaccines we have had for years. They have a little bit of virus in them. Can you talk about when those might be available?
Yeah, you know, the AstraZeneca is one of them. That's the one that is being used in Britain right now. It's not available yet in the United States. The efficacy of that vaccine is lower than the two that we have available to us. And, you know, the more traditional issues with vaccination are more common, in fact, with those, because in some of those viruses, they're using killed virus, or they're putting, you know, part of the viral code into a defunct virus coat and injecting that. And they have some of the more traditional side effects for those. So I actually think that the mRNA vaccines, the ones that are available to us in the United States right now, are probably safer than the old-fashioned ones. They are less studied, but I think Johnson & Johnson in the US also has one of those coming out. We have to just stay tuned for the data. I don't know all that data at the moment. Those are great questions.
Do we know about the mutation patterns of the virus?
Yeah, not too much yet. You know, there are a lot of different coronaviruses, but the SARS-CoV-2 virus that's causing this COVID-19, it looks like there's this one variant that popped up in the UK, and there's probably some of it in the United States. And when people get infected with it, it seems to be more to cause more symptoms. It's very likely to be equally preventable because it has that typical spike protein on it. So the vaccine should take care of that one also. But viruses mutate. That's what they do. That's why we get the flu vaccine every year. And so it would be expected that this coronavirus would also mutate. The question is whether it'll mutate enough to mess up that spike protein and the immune response to it.
If I miss my appointment for the second dose, how much time do I have to get it?
Yeah, you should get it as soon as you can get it. We know about a 3-week difference. Most vaccines that require dual dosing, some of them are many months later, like hepatitis A is 6 months later. You can get it whenever you remember that you messed up and you didn't get it, you should go get it. So yes, you definitely can get the second dose.
And where can I get a list of the ingredients in the vaccines?
They're available online. I Googled them and found them last night. So I can help you find them, and we can, make those available to everybody.
I think Goody put them in the chat. So great. Let's see. Do pregnant or nursing women have negative reactions to the vaccine?
Yeah, when they did the drug trials, they tried not to have any pregnant or nursing women in the drug trials because, they were testing the safety and so on of the vaccine itself. A handful of pregnant women did sneak in. They had negative pregnancy tests, or they didn't think they were pregnant, and then they were found to be pregnant. And those people had no problems with the vaccine. Their pregnancies have been fine and they've proceeded just fine. There's not a ton of data about that. There's really no reason to believe that the vaccine would be problematic for people who are pregnant because of the way this vaccine works. So I believe that pregnant women can get the vaccine. It's not being pushed real hard by the CDC, but they're saying that in a conversation with your OBGYN or your midwife, you could have a conversation and make a decision about that.
Patrick, I think this one's for you. Do we have both vaccines available in Chicago? If so, will we get a choice of which one we get?
I think we've just got the one at this point. And so no, there wouldn't be a choice at this point. But when they do, when the others do become available and the second one becomes available, I think it'll be a conversation to have with medical provider when we're going to be doing the distribution. So if you're going to a city of Chicago point of dispension, point of disbursement, I think it'll just be like what we have available is the one that we're going to be using with folks.
And which one is the available one now? Is it the Pfizer or Moderna?
Thank you for that. I actually don't remember.
Pfizer. It's the Pfizer that's currently available. I think the Moderna is starting to be available in Chicago also, just starting, but the Pfizer is the one that's rolled out.
So Dr. Forst, if the vaccine only attacks the sticky substance from the virus, please explain again how that makes future COVID exposure less severe.
Yeah, so what happens is it makes that spike protein, that pink globby thing that you saw in the video, and then your body mounts its normal immune response. So it develops antibodies that are very specific to that spike protein. And what happens with those immune cells or that immune reaction is those cells kind of, after they take care of the acute problem, they retain that memory of the spike protein and they go kind of hide and rest. And the next time a virus enters that has the spike protein, they're alerted and they come to the rescue and they stop that spike, they attach to that spike protein that's on the coronavirus and they destroy that. They prevent it from being able to enter cells and being able to infect you. So that's how it works. They're called memory cells, and that's a normal function of your immune system so that we can recognize foreign substances, infectious diseases, and so on. That's how all vaccines work. You develop these memory cells, these immune memory cells that come to the rescue when you get exposed again in the future.
So this question's come up again a couple of times. So if you get COVID after getting vaccinated, how does it impact if you're, or does it impact, sorry, if you're symptomatic or asymptomatic?
Yeah, it looks like, excuse me, it looks like the vaccine is pretty protective. So most of the people, most of that 5% that got reinfected, that got infected with COVID after getting the vaccine had a much milder case of COVID. So that's what it looks like so far. Again, we're all, you and we are all watching the data as it rolls out, but that's what it's looking like so far.
And can people who have recovered from COVID still spread the virus?
Probably not. So, what was happening for a while early on is that people got COVID and then they were tested over and over again, and their employers were demanding a negative test before they went back to work. But it turns out that you have sort of the particles left over after you've been sick. And when you do the test for the virus, sometimes even weeks after you've recovered, you are getting positive testing. So even though you're not infected and you're not infectious, meaning you can't give it to anybody else. So now that we know that, the recommendation is for people to wait either a full week after they first got sick, if they recover in a day or two, to wait a full week, or if they're sick longer, to wait a few days after they recover, and then just go back to normal life. So you don't have to get retested. In fact, if you get retested, it only adds confusion. You only start worrying about whether you can infect somebody. But when you're not sick, it looks like you can't reinfect. You can't infect somebody when you've recovered.
And can people who are vaccinated still spread the virus?
You mean if they don't catch the disease? So if they catch the disease and they have a mild case, they can spread the virus for sure. So that 5% could certainly spread the virus. Could you be exposed and not catch it and transmit it to somebody else? Probably no. Really, the way you're spreading it is because it got into your cells. You started to reproduce that virus. You're producing large amounts of it, and you're spewing it out into the environment where other people are standing around. So probably you can't, if it's not getting into your cells, you don't have a big enough dose or amount of the stuff in you to spread it to anyone else. So not likely at all.
In your opinion, what is the estimated date range for the rest of the general population to get access to the vaccine?
I think that's Patrick.
I think it is too. I mean, I think it's actually Dr. Arwady. So, I mean, I was on a briefing. Dr. Arwady does briefings for the entire health department every Thursday morning. So I was on one earlier today, and she spoke about this specifically because everybody's got questions about the phased rollout that we're doing. Our hope is that we will have the ability to do sort of general population vaccinations in the summer. Maybe early fall, but late summer. That's what we're working toward. That's our goal.
And I think this is for you, Patrick, too. Will clinics be collecting antibodies even though we now have vaccines?
I don't know.
You mean looking at, I think that looking at antibodies is only going to be for the sake of research studies and to better understand, you know, what happens in response. I don't think antibodies are being tested for in the regular rollout of the vaccine. It's too much stuff, you know, they're not collecting anything. They're really only injecting you.
Are there, Dr. Forst, are there leftover particles for people who get the vaccine, just like there are for people who have been ill before?
No. The answer to that is no, that the mRNA that gets injected into you, it denatures after minutes to hours. It's not left over. It would not be detectable. You could not detect a virus in somebody that got the vaccine at any point because it isn't the virus that is being injected into you.
I fast often. Will that affect the benefits of getting the vaccine?
It shouldn't. I mean, if you're doing that safely, you know, the people that aren't mounting a good response are people whose immune system isn't working properly. When is your immune system not working properly? You know, if you're starving yourself all the time and frequently, you know, kids in starvation situations do not have good immune responses. Is somebody who fasts for a day every month or 3 days, you know, 4 times a year in that category? I don't think so. But if you're fasting a lot, it's probably not great for your immune system. And then it wouldn't be dangerous for you to get it. It's just that you might not mount an immune response to it.
Okay. First, I want to recognize, Guy, I see your question about pods, and I know that Patrick is going to cover that right after the break, so I will just, we'll hold off on that question, but I see it, so I wanted to recognize that. So CDPH, some places have the vaccine in storage, but don't have the capacity to distribute. Logistically speaking, how prepared is the city to vaccinate the mass population in this wonderful city? And will there be enough vaccination points and individuals available to administer doses?
That's Pat.
Yeah, so that's a great question. So there's a whole team of folks within the emergency preparedness unit at the Chicago Department of Public Health who work on the logistics. There's a guy named Chris Shields in particular who's like the logistics guy for this. And yeah, so logistics wise, we are prepared. We have been preparing for this for years and years and years and years, not specific to COVID, obviously, but like, yeah, there's a whole team of folks whose job is to look at how would we do such things should a pandemic take place. And they have been working on the logistics for distribution of the vaccine since January of 2020, coming up with variations that would be implemented depending on what comes out in the specific vaccines and what are the requirements of the different vaccines. So yeah, they're prepared. We are prepared in that. There is, and there, I think there will always be, so there a need for more people involved in working those vaccination efforts at various levels. Whether it's, you know, the kind of roles that we were asking folks to participate in as part of the contact tracing core efforts, or as medical providers, or as people who are giving the vaccinations themselves. I think there's always going to be a need for more folks doing that kind of thing. And we are working right now as we're standing up those points of distribution next week to get as many folks lined up to participate in those as possible. So yeah, I think based on the rising blood pressure I see in my colleagues in emergency preparedness, like they're working themselves all over the place to get it to work. So they've got everything in place in terms of logistics.
So I know we're close to the end here, so I'm going to do 2 more questions. Dr. Forst, will the vaccines protect against the new mutation? Can you explain again?
Yeah, sure. It should protect against the new mutation because the new mutation is inside the viral particle, and it isn't affecting that red spike protein on the outside of the particle that lets it be, lets it get into the cell. So that spike protein of the new variant is identical to the typical COVID virus. And this vaccine should prevent the infection with the new variant as well. Yes.
So I think we'll end on this one. So knowing, and this is for either one of you or both, knowing that even after being vaccinated, you can't go back to acting normal until everyone is vaccinated, doesn't that put a damper on the urgency to get vaccinated?
It doesn't put a damper on it for me in any way, shape, or form. To the contrary, as soon as people are allowed or ready, they're at the level that they're ready to get the vaccine, they should get it. The 9 million people in greater Chicago are not going to get vaccinated all at the same time. We need to step up and do it when it comes available to us. And I'll just say on a very personal note that this is our way out of it. There are people in my life that I want to see. I have a 101-year-old father. I have a pregnant daughter. I want to see them. I want to see the baby. This is our way out. We have to do this.
Yeah, I agree. I think nothing is going to flip a switch and get us to be able to go out and do all the things we were able to do before. So it's going to be steps and progression toward doing that. And so when the opportunity presents itself to me, I'm going to jump on it. And similarly, I haven't seen my family since March. That's ridiculous to me. And anything that I can do to make that happen, whether it's, rent an RV and drive across the state or the country, because my family lives in California, and by way of that, isolate for 2 weeks while I'm driving across, then that's what I'm going to do. If I get vaccinated, then that's what I'm going to do, because I want to be able to have those interactions again. And yeah, it's not going to mean, me getting vaccinated doesn't mean that I can go out to restaurants or go to concerts, and it's not that, but it does mean that I can do a lot of the things that are really, really important to me.
Thank you both so much. Again, for the sake of time, we're going to end now. I know there's a bunch more questions that came through, so we'll definitely follow up with that via email. Again, thank you, Dr. Forst. Thank you so much, Patrick. Right now, let's take a break before we jump back in. So let's come back at 11:40. Thanks, everyone.
So great to see you all.
Okay, I think folks are starting to trickle back in. If you're back, can I get a hello in the chat? Thank you, love it. All right, well, so let's keep moving forward. Again, thank you all so much for all the excellent questions. So again, this session is being recorded. We are going to work on getting those recordings out so you can review them later. And we'll follow up with links to resources that were referenced in the chat after the session today. Okay, so for the rest of the day, we're going to first, I'm going to turn it over to Patrick. He's going to talk a little bit about, the potential roles for the contact tracing core in the vaccine education and distribution. Then we'll do some short breakout sessions, and then we'll wrap up. So Patrick, I'm going to turn it over to you.
Thank you, Melissa, and I will do my best. Thank you for all of the chat comments to speak up so that folks can hear me. All right, so, right. first and foremost, and I've alluded to some of this stuff earlier during the Q&A, and so there may be more time for some more sort of contact tracing core specific questions and answers during this. The implications for the vaccination opportunity and for vaccines in general are massive, right? Like, we are all impacted in one way, shape, or form, either directly or indirectly by COVID, and therefore we as human beings have a right to as much information as we can possibly get. Similarly, we have a right to arguing about that information. We have a right to respectfully questioning the information, the validity of it. So long as we're able to have that dialogue about the information that is available, where we're able to express our concerns, our fears, our hesitations, as well as our positive excitements, I think we're doing a good thing. And so we want, so implication number one is we just want this information to be as available to you all as possible. And we want this information to everyone. So we know full well that you all are already getting questions and comments about the vaccine through the contact tracing and resource coordination efforts that you're doing, the same way that, back when testing was a newer thing, like, we were getting tons of questions about testing technologies and what do all these different things mean. So it's like, we know what's already happening. So we want you to be prepared to, as I mentioned earlier, both in terms of like the information you have, but also in your confidence and your level of comfort in talking about the information that is available. So really take a look at the CDC website, the CDPH website that we've put in the chat a couple of times, because it is going to be an important part of the work that you do as a contact tracer or a resource coordinator. But also, we're all humans. We all have interactions with folks outside of our professional world. I know I do. I know I get like calls from all sorts of like friends and family members and loved ones and neighbors about the vaccines. And I'm like, not a doctor, dude, social worker right here. But it is a part of, like, I can provide information. I can share the information. And it's important that I find that it is important that I do so. And so, like, sharing these pieces of information with your friends, your loved ones, your lovers, your neighbors, your coworkers, whomever. But also, it's really important that you feel that you can take the feedback, the information that is coming from those other people, and bring it back to us. Like, the communication, the information exchange needs to be bidirectional. It needs to be coming from us to you all, and then from you all back to us. Because, like, we got some expertise, y'all got other expertise. Let's have these working together so that we at the health department are able to improve upon what we're doing, and we will provide our information so that you can improve upon what you are doing. So just it is huge in a number of different ways. I do want to say, like, when we first started the contact tracing core and the resource coordination hub, it was it was in response to COVID spread. We saw that we needed to create this massive workforce of folks who would do contact tracing, do resource coordination. And that was, the immediate response was we needed folks to address this immediate need. And at that time, we didn't have a vaccine, and we had some speculation as to when a vaccine would come available, and and it happened. And so now we need to be able to shift. There is not going to be a point, however, when contact tracing and resource coordination are not absolutely necessary components of our response to COVID, but also to other public health concerns. So I want to just reiterate to folks that while there are implications based on the vaccination opportunity, like, contact tracing still needs to get done. And we still need a whole bunch of folks doing contact tracing. Do we need 600 plus? Maybe not. I mean, I think y'all know from looking at the volume of contacts that are coming through Salesforce, they're like, we're not all super busy day in and day out with contact tracing, and therefore, like, here's another opportunity for us to be involved in making some impact. But it is still contact tracing is still gonna be a thing that we need to do. And just so everybody's clear, contact tracing it's like a foundational element to public health. So it's not gonna go away, it's gonna shift. And one of the things we need to be able to do is shift along with the presenting needs of our community based on what folks are telling us and based on technologies and innovations and all of that. So yeah, we need to be able to adjust, and similar to like I mentioned earlier, I've been doing HIV related work for like 20 some odd years, and had to shift over to COVID like 6, 7 months or 9 months ago at this point. Like sometimes we need to shift, and that's part of what we need to do. So there are additional opportunities that have been presented to the Contact Tracing Core and Resource Coordination Hub, and there are other opportunities that will be presenting. So the Chicago Cook Workforce Partnership did send out a survey about a month or so ago, and I think they're going to be sending it out again today if they haven't already, about some of these different opportunities. So whether it's some peer-to-peer texting work that's being done, that's like census tract specific work, so looking at hotspot areas of the city where we can engage in texting with folks, which I received like a week or so ago. I got a text out of nowhere from that program because I live in an area where cases are going up, to working at the vaccination points of distribution. So again, that survey went out, it'll go out again. I have a meeting later on today where we're working on some of the finalizing staffing plans for those points of distribution, because we're going to, like, starting next week, we're going to have 4 different sites going 5 days a week. So like we have a lot of really fast movement happening related to staffing those up. So once you see that survey coming from the Chicago Cook Workforce Partnership, I urge you respond, especially if you're interested in doing it. Just respond and let us know as quickly as possible so we can try to get you plugged in. Because at this point, I think we're being asked to find, if we can find 100 folks to work full time next week, then we're going to have work for 100 folks next week working specifically on the points of distribution. There is also, and there are already some folks who have been contacted about this. There was another survey that went out from the Chicago Cook Workforce Partnership around call center work. We mentioned earlier getting folks registered to get vaccinated. So some of the essential workers, and also like dentist offices and home healthcare providers and some manufacturers, there's work that needs to be done that is calling those offices, those businesses, and walking them through registering their staff to get vaccinated. And that's a lot of work. I think last week there was like 2,500 folks who either got called about being registered or got registered. I can't remember off the top of my head. But so we need folks doing that as well. There are hyper-local efforts that are going on that I urge you all to learn more about, get involved in as you like. So, for example, in Belmont, Craig and Northwest Side Housing is leading some efforts around hyper-local connections of folks in need, whether they have COVID or are contacts or just in need of support, so that they don't become contacts or don't get COVID. Where there's a network of organizations and individuals who are doing work in the Belmont Cragen area specifically to address the needs and perspectives and experiences of folks there. Same thing's going on in 60629 and 60632. Those efforts are being led by Southwest Organizing Project, one of the community-based organizations involved in the Contact Tracing Core, where they're doing similar things, where they're working around, going and talking to folks in those 2 zip codes, and connecting them with whatever resources they have at their disposal to try and prevent folks from, getting to us through Salesforce. So like if we can connect folks with resources so that they don't get named as contacts, that's great. That's a beautiful thing for us to be supporting. Similar, the 22nd Ward has got a whole bunch of work going on. I never remember, I know there's another community-based organization involved in the Contact Tracing Core that is already involved in those efforts. But we also know that we got folks on this call who are probably residents of some of those zip codes, some of those areas, and you can get involved as individuals as well as have conversations with your supervisors and with your community-based organizations about how those efforts could be incorporated into what we're paying to have you do. It's part of the COVID response. It doesn't have to be just contact tracing. It can be a lot of these different efforts. And similarly, we continue to be very interested, and this is something that we across the partnership have shared. So CDPH, Chicago Cook Workforce Partnership, UIC, Sinai Urban Health Institute, Malcolm X City College, NORC, we're all very supportive of y'all coming up with some of your own ideas of things that can get done. And whether that's like a bunch of contact tracers who are talking with one another, come up with an idea of something that could be done, or whether that's one of your community-based organizations come up with something based on the experiences that you're seeing and hearing from your constituents, your community members. Like, all of that's dope. Put it together, let us know so that we can support and monitor, because we do need to monitor these things. But I would love to see more programmatic intervention ideas, things that you all want to do, that we can try to figure out how to support you in doing to really make an impact that is local. Because some of these efforts that we're talking about are citywide, and some of it can't be citywide. Sometimes citywide stuff doesn't work. Sometimes it needs to be local. Sometimes it needs to be block by block. Sometimes it needs to be neighborhood by neighborhood. Sometimes it needs to be person by person. And while contact tracing is one opportunity for that person-to-person interaction, it's not the only one. And I would love to support more efforts along those lines. And we are working on, and this is like very, very, very early stages, we're working on some more formalized, like how can we support folks in becoming like vaccine ambassadors. It's still really early. So these are all different efforts that are coming into fruition that continue to reach out to us about, and continue to suggest other opportunities. Because again, like, we have ideas, you have ideas, you're experts, we're experts. Like, let's share it as peers about what can be done that can make the most positive impact we can do. And I do want to sort of close up with, and then we can have, if there's time, we can have some more question and answers about the core and the hub. When we put together the contact tracing core, like I said at the beginning of this, the initial goal was to have a massive, well-trained, experienced, passionate, local core of people, workforce of folks who can respond to the COVID contact tracing needs. And that was like our immediate need. But we also had longer term needs, right? So we wanted jobs for folks. We wanted economic opportunities for community areas and for individuals and families who had been impacted not just by COVID, but by decades and generations of racism and white supremacy and not getting resource and development in community areas. And we wanted those things as well. We also wanted the opportunity to develop what we sort of talk about as being public health cores. So sometimes we have these conversations about when can we get back to normal? At what point during vaccination distribution will we be able to get back to normal? And I really want us to think about normal as being better than it was in 2019. And part of what we're trying to work toward is how can, whenever that happens, whenever we're able to say, COVID is no longer the big priority, scary thing, that we will find ourselves in a position where across the city, we will have hundreds upon hundreds of individuals who are trained and experienced and confident and empathic and communicative and local and have participated in citywide efforts, who can be leaders in their communities, in our communities, who can be advocates, who can be teachers and educators, who can also be conduits of information, so that when we look at ourselves after this is all, not done, but calmed down a bit, that we'll be so much better prepared for jobs, for careers in public health, for being able to take care of ourselves and each other. So it's all part of this sort of professional development idea toward a point where we are going to be a healthier place because of these experiences, these opportunities that we've had to try and make the most out of what has been a really, really hard situation. So those are the goals, right? And so, when we think about vaccination points of distribution and the opportunities there, to us, it's all less of the health department. It's all part of this goal of, we want to respond to COVID, but we also want you all to have every single opportunity you can possibly have to walk away from this being I'm a public health professional, because I've got experience working with vaccination, which is a huge and constant need. I've got experience doing contact tracing, which is a huge and constant need. I've got access to information. I've talked to doctors. I got all this stuff that I can then go be a force for the well-being of the people in my community, in my neighborhood, in my household, and in my city. Thank you. That's what I got.